Mr. Limbrick to move his notice of motion 454.
Thank you, President. I'd like to move notice of motion 454 in my name, and I'm pleased that there's so many people here to listen to it. I'm pleased to rise to speak on this important motion. It may seem a trivial matter to some.
Makes me want to have a cigarette.
Of what significance are these new devices, probably first seen by and used by hipsters in Brunswick? To understand this, we really need to appreciate the impact of tobacco on the health of Australians. As the motion states, smoking was estimated to be responsible for 9.3% of the total burden of disease in Australia in 2015 and was responsible for more than 1 in 8 deaths. Smoking is widely recognised as being the largest single contributing factor to the disease burden in Australia. Many Victorians have had to deal with the tragedy of smoking-related illnesses in their families, including members of this chamber and of my own family. It's a very important issue. To understand where vaping and e-cigarettes fit into the picture, it's worth reflecting briefly on some of the history of tobacco harm reduction and the development of traditional nicotine replacement therapies. One of the early pioneers in this area was the late Professor Michael Russell, who began working in the Addiction Research Unit of the Institute of Psychiatry in London. His early work highlighted the role of nicotine in smoking addiction, with the ARU conducting the first studies of nicotine chewing gum, also pioneering work on the nicotine nasal spray and efficacy of nicotine patches. The point of all this can be summarised in Professor Russell's most famous quote from 1976. People smoke for nicotine, but they die from the tar. In one of his latest papers, published in 1991, titled The Future of Nicotine Replacement, he anticipated the e-cigarette industry. I'll read 2 quotes from that paper as they are perhaps the best illustration of the gravity of this debate. And I quote, "Sometime in the 21st century, we would see the rapid demise of tobacco smoking. How soon this can be achieved will depend on how soon we adopt rational policies. It is essential for policymakers to understand and accept that people would not use tobacco unless it contained nicotine, and that they are more likely to give it up if a reasonably pleasant and less harmful alternative source of nicotine is available." End quote. This is what we have now seen. It seems that one of the problems that opponents have with vaping is that it is pleasurable to consumers, but this is exactly the reason that it's effective. Also in this paper he stated, and I quote, "It is not so much the efficacy of new nicotine delivery systems as temporary aids to cessation, but their potential as long-term alternatives to tobacco that makes virtual elimination of tobacco a realistic future target." End quote. Conventional nicotine replacement therapies have played a role in reducing smoking prevalence. For many people, they just don't hit the mark though. While Australia was considered a world leader in tobacco control, despite some of the highest taxes in the world and being amongst the first to introduce many other measures, the efforts have failed to translate into any rapid decline in smoking rates recently. Instead, we have a growing illicit tobacco market run by organised crime and working class people with less money in their pockets. Amongst OECD countries, Australia is on its own in prohibiting the possession and sale of liquid nicotine. In overseas jurisdictions, they have seen smoking rates fall significantly, corresponding with higher rates of e-cigarette use. A survey on the use of e-cigarettes use and attitudes in Great Britain, conducted on behalf of Action on Smoking and Health, published in 2019. In England, the smoking rate amongst adults aged from 18 fell from 19.8% in 2011 to 14.4% in 2018. Meanwhile, the number of people using vapes has grown to 7.1% of the adult population. The main reasons given for using e-cigarettes were to quit smoking and prevent relapse. The UK and New Zealand have models where formal smoking cessation services and their public health institutions more broadly support the use of vaping to help stop people smoking. They also have sensible regulations and age restrictions, and with the passage of some recent reforms in New Zealand, they also ban advertising. The laws in Canada vary in each province, but are broadly the same. I could cite studies and examples of sensible regulations all day long, but the key point here is that even the vast majority of opponents to vaping agree that it is safer than smoking. Some dispute the claim from Public Health England that vaping is at least 95% safer than smoking, but very few dispute that there are less chemicals and less toxins present in e-cigarette vapour. When this issue has been raised before in this chamber, the issue of vaping-related injuries that occurred in the United States has been raised, but this doesn't highlight a problem with a legal and sensibly regulated industry. It highlights the dangers of prohibition and black market products. We know that vitamin E acetate was found in 48 of 51 patients that were examined by the CDC, and this was related to THC or cannabis vaping products. There is no evidence that this had anything to do with vaping at all. There have also been concerns that some e-liquids sold in Australia have unknown or dangerous ingredients. A great way to resolve this uncertainty is for a legal and sensibly regulated industry. The Liberal Democrats oppose excessive and restrictive regulations, but consumer transparency is pretty reasonable. You should get what you pay for. This debate, however, shouldn't be a back and forth debate about citing our preferred research or whether the tobacco industry is trying some new trick to hoodwink us all. We should be considering the rights of consumers to choose a less harmful alternative to smoking tobacco. It's almost a catchphrase these days to talk about the lived experience of various groups. The budget includes this phrase multiple times, and I don't have a problem with this. The budget includes a proposal for a mental health service that is co-designed by people with a lived experience of mental illness, and this may well make for a better service. But this debate should really reflect on the lived experience of the more than 500,000 people in Australia who use e-cigarettes, the vast majority of whom are ex-smokers. The Liberal Democrats have long been supporters of vaping, and I've heard many stories of people who credit vaping with improving their health or even saving their lives. I encourage members to actually listen to these stories of real people if you want to truly understand the issue. There is an Australian Senate Select Committee currently inquiring into tobacco harm reduction, which has received over 8,000 personal submissions. Obviously, I can't summarise all of those in this debate, but to get a bit of a sense of it, I'll read a few highlights from just the first page of submissions. Ms Maureen Steele, 51, works as a health education officer for the New South Wales Ministry of Health and started smoking at the age of 18. After trying to quit cold turkey and with the assistance of various nicotine replacement therapies, she tried vaping 18 months ago. 3 years ago, her CO level was 32 parts per million. For most smokers, it is about 17, and for healthy people, it's 3. Her CO level is now 8. Ms Yvette Hopkins, aged 45, is an administration assistant in the health sector. She started smoking at the age of 15. Her and her husband tried all the standard ways of quitting, including various nicotine replacement therapies, but were not successful. After seeing her mother switch to vaping and then reduce the nicotine and quit entirely, and watching her sister switch to vaping, she gave it a try. Since vaping exclusively for 2.5 years, she no longer has a wheeze or a cough and hasn't had a cold since, and has improved oral health. Grant Clark, aged 52, started smoking at the age of 14. He tried all the standard ways of quitting, including Champix, which left him depressed and suicidal. Vaping has changed his life, no longer suffering shortness of breath. His submission ends with a short statement in all capital letters: vaping saves lives. Also in this place, I've heard colleagues from across the political spectrum compassionately consider the stories of various communities. It's time that we listen to the hundreds of thousands of Australians who vape and act accordingly.